I would say I felt safe the whole time, knowing that the doctors were going to take care of me. I'm Paris Rodriguez Yarbro, and I'm the proud mother of Zadie Lee Yarbro. The reason I chose Texas Health Frisco is I've been going to the same OB for about 15 years, and this is where he delivers. So I really never even thought about where we were going to go because this is where he goes, and I knew that's who I wanted to deliver our baby. I would say that whole experience from arriving to the hospital, from me getting to hold her, was maybe 45 minutes. Like, it was really, really fast. And then after that, I had a baby.
Here at Texas Health Frisco, our goal is to provide seamless, high-quality care to all patients that walk through the door, especially patients that have experiences like Paris's. So we want to be able to provide the care that you expect for those expected admissions, but also be here when you have the unexpected arise.
When I woke up on Saturday, I was in a lot of pain. Everything hurt when I woke up the next morning. And I told my husband, I need to lay in bed and I'll help snuggle the baby, but I can't be up and down a lot today. I kept telling my husband, I don't feel good. I'm gonna call the emergency line at the OB's office because something doesn't feel right. And I explained to the doctor on call what I was experiencing, and she said, yeah, I think you need to come to the hospital. So we had to pack up our 4-day-old and drive 20 minutes across town at 11 o'clock at night to come and be readmitted. And that's how we ended up back at Texas Health Frisco the day after I came home from being released.
Well, we did have to go back very shortly after. I was within a few days after the birth because she was experiencing shortness of breath, and it just kept getting worse and worse. So we immediately went back to the hospital.
All I could really tell them was I'm short of breath and I couldn't hold my daughter. And then the nurse came in and she said, I know they saw something on your chest scan, but I think they just need to run more tests. And she said, but I'm really glad that you came in when you did because you need to be here. I started hearing the words congenital heart failure thrown out a lot. So there were so many tests that happened that day that I pretty much spent half the morning thinking that I had congenital heart failure. And then they wheeled me downstairs to a different floor to do the full body scan. And I had a panic attack when I was in there because they laid me down flat and my breath was so bad that I could barely breathe and I was laying down flat. I pretty much spent that whole entire day thinking that maybe I had such a beautiful summer and all of these memories so that my husband could show those to my daughter, because I was really starting to think that I might not be around to see her. I never voiced to him the fear that I started having about maybe not being able to watch her grow up, but I started feeling it, but I was afraid to say it. It was a dark day. And of course, my dad came up here and he kept telling me, you're okay and God's got you. And she said, well, we still don't know what is going on, but we know that you definitely don't have congenital heart failure. For whatever reason, I guess when you have a C-section, when you have surgery, they pump you with more fluid. And apparently at the end of my pregnancy, I had retained a lot of fluid. And then usually when women give birth, that slowly drains over the next week. My body, for whatever reason, never let go of the fluid. So I had all of this fluid sitting in my chest, weighing on my heart and lungs. So it was really good when I came in, when I did. They give you this medicine and you just pee all the fluid out. I just literally laid in bed and peed for 2 days until I could breathe again. But I remember when I was able to walk for the first time without my oxygen dipping, I knew because the nurse squealed and started clapping her hands. And she said, like, we're so sad to see you go, but we're so happy for you. It was so scary. And then knowing that I was going to be okay, I just wanted to get home and started to feel normal again. I felt really taken care of both times. The nurses were amazing, and I felt like they were cheering with me throughout every step of my journey. I can't imagine having been anywhere else except Texas Health Frisco.